Okay, well, recording in progress, so I guess we can start. So, good evening to everybody that is with us today and those who are watching from home. Those who don't know me, my name is Dan Kaufmann. I'm a research assistant professor here at the Department of Neurology at the University of Utah. And those of you who this is their first time that they're joining us, today is going to be tools and techniques for headache management. Each and every fourth week of the month, we're doing kind of a little workshop that we're teaching some basic skills or do some meditation. And the idea is that we think that information is wonderful, and so Headache School is always giving information, but we also think a lot of the people that are watching us would like to have some basic skills, something that they could actually use and take that to their lives and use it pretty much immediately after the session. So each and every time, each and every fourth week of the month, we're giving tools and techniques. We're just giving 1 hour of specific technique that you can take with you and use it, anywhere, any way you want. And today we're going to talk a little bit about hypnotherapy and does it help migraine. And so again, even though we're going to have a presentation just in a short while, as I created this uh, session today, I thought that there's a lot that I can say about hypnosis and hypnotherapy and migraine, but I really wanted to focus on providing a skill. So I'm just going to start by giving really the basics of the information that I think is going to be relevant for the skill that we're going to learn today. And then the skill that we're going to learn is how to do self-hypnosis. So without further ado, I'm just going to share my screen and just give me a thumbs up that everybody can see my screen. So, okay, wonderful. See that I can show my screen. Okay. So the topic is hypnotherapy and can it help with migraine? And before we move on, I just wanted to start with a very brief definition of what is hypnosis, because a lot of people, when they hear about hypnosis, there's a lot of mystery and mysticism even about hypnosis. A lot of people don't know what hypnosis is. There's a lot of fear about hypnosis that has been created by movies that we see this mighty hypnotist hypnotizing someone to rob or to murder someone. And we have all these, Las Vegas shows that people walk on stage and the hypnotist kind of like makes them quack like ducks and do all these silly things. But actually, when we look at it, hypnosis is not that mysterious. Originally, hypnosis was defined as this trance or some special state that also involves very deep physiological relaxation. But a lot of research has been done over the years to better understand what hypnosis actually is. And nowadays, we do know that hypnosis is considered a state that we're very much focused on a specific idea or specific image to the exclusion of anything else. And the reason that we're so focused on that idea is because we have the expectation that by focusing on the specific idea or suggestion, we're going to elicit a certain either physiological or emotional response. And that's the kind of the general idea behind hypnosis, that we are getting ourselves into this specific state that we're focused on an idea or image, and we want to elicit a specific outcome. And of course, with the more we train and realize what hypnosis is, the more we can increase our ability to give ourselves suggestions, and thereby giving suggestions, we're expecting to see certain responses and certain changes. Of course, when we are doing hypnotherapy pretty much uses this skill that a lot of people have of getting into the hypnotic state, and we're using that for therapeutic purposes, such as pain reduction, such as reducing anxiety, reducing depression, changing habits, and so forth and so on. So this is pretty much a very, very broad definition of what hypnosis is, and it's important for us to understand what that is so we can do something about it and not be afraid about, oh, this might be some sort of a mystical thing. And with that in mind, I would also like to cover some misconceptions about hypnosis, because there's a lot of it, because there's so much mystery around hypnosis. And I've heard many, many people assume that hypnosis is some sort of a state that they could lose control, or the hypnotist might make them do things that they don't want to. And there's a reason for that, because there's a lot of movies that, they show the hypnotist that is hypnotizing someone and ask them to rob a bank or hurt someone. But actually, research has indicated that there is nothing farther away from the truth, because even under hypnosis, nobody can do anything against their value system. So no one can make anybody do something that they don't want to do. But again, this sense of loss of control is a big fear under hypnosis, but actually this is incorrect, since most hypnosis is self-hypnosis, as we're going to talk about, and there's nothing that the hypnotist can do to someone under hypnosis. Some people think that hypnosis is a state of sleep or loss of consciousness, and they think that, oh, I'm just going to go to this hypnotist, I'm going to fall asleep, I'm going to wake up, I'm going to be completely healthy. Well, actually, hypnosis, if you fall asleep, hypnosis ends. Hypnosis is, even though the original term hypnosis is it was from Greek, the name hypnos, which is the god of sleep, but actually hypnosis is not a state of sleep. And if someone falls asleep during hypnosis, hypnosis pretty much ends. In hypnosis, the individual is fully aware of what is going on, and it's not that they can just go to sleep and have changes occur to them. Only gullible or weak-minded people can be hypnotized. This assumption that, oh, I'm tough, I'm strong, I'm have a very strong will, and no one can hypnotize me, and hypnosis is only for those who are weak-minded. But actually, again, hypnosis was correlated with a high level of intelligence. So actually, the more intelligent people are, the better they can be in hypnosis. And the only people actually that cannot be hypnotized are those that suffer from either severe mental retardation, or they're not connected to reality, or like a severe mental disorder. So thinking that only gullible or weak-minded people can be hypnotized, again, that's incorrect. Everybody can enjoy hypnosis if they set their minds to it and use the skills, some of them that we're going to learn today. People think people are afraid of revealing deep secrets. Again, this is connected to this loss of control, of not being able to control what I say, what happens to me. And again, it's important to understand that even under hypnosis, people are in control of what is happening to them. And if someone doesn't want to cooperate, or doesn't want to participate or say anything, there's nothing that can be done. Hypnosis is voluntary, and no one can make you go into hypnosis. It's only a state that you allow to happen to you, and it's not something that someone does to you. If I go too deep, I might never come out of it. Again, this idea that I can get stuck in hypnosis, but it's not different than falling asleep. Just like we're not stuck in sleep, we cannot get stuck in hypnosis. And if we do fall asleep, which definitely can happen, we wake up afterward just at whatever time, but we cannot just get stuck in it. I'm afraid hypnotists will force hypnosis on me again, this idea of loss of control or make me do illegal things. And again, research indicates that it does not happen. No one can make anybody do anything that they don't want. So I hope that by talking about those misconceptions that are so frequent and so many people are think those things because they're not well informed about hypnosis. I hope that by going over them, I'm able to convince people that those are misconceptions and they are far from the truth about hypnosis. Another important thing that I wanted to emphasize in here, and there's so much to say about hypnosis theory and the state versus the non-state theory. And again, we don't have much time, and I really just wanted to touch on that notion that during the years, the research on hypnosis pretty much is divided between those people who are what you call estate theorists. They believe that hypnosis is like a special state. They emphasize hypnosis is so much different than everything else, and it's like it's some sort of an altered state, trance state, something even magical that the hypnotherapist can do on someone. However, on the other end, which in my humble opinion, most researchers of hypnosis are non-state theorists. And what that means is that they believe that hypnosis is nothing special, is not a special state. They actually emphasize how much hypnosis is similar to many other things that we do in our daily life. And through a lot of research, they focused on what is it that the individual needs to do? What are the psychological and physiological attributes that allow a person to get into the hypnotic state and use hypnosis for their benefits? The non-state theorists have researched a lot, and they came up with the specific attributes that once someone is taught what is it that they need to do, they can enjoy and benefit from hypnosis. And this is something that we're going to talk about today. I will say that personally, I'm more a proponent of the non-state theorist because it takes the kind of magic out of hypnosis and it demystifies hypnosis and make it much more available and much more accessible to everybody who actually wants to benefit and use this amazing state of hypnosis for their own benefit. And we're actually going to practice that today. So this is a little bit about hypnosis. Again, I could have gone more, but because I'm more focused on providing a skill, I just wanted to cover those basic things. And another thing I wanted to say, because this is headache school, and we talked a little bit about hypnosis, but how does hypnosis can help migraine? So I'm only going to mention that there is a correlation between stress and migraine, meaning that there are several stressors that can exacerbate migraine. Some of them are childhood adversities. There is a link that have been shown between previous, previous adverse events, whether physical or emotional, and the occurrence of migraine later on in life. Currently, there's like workplace issues like bullying, discrimination, harassment, problems with healthcare, like when people are experiencing skepticism or they're misdiagnosed or there's issues with insurance, or people that feel alienated, or feel that they're bothering their medical provider that doesn't know what to do with them. That induces a lot of stress. Sometimes a lot of people feel alienated from their family, from their friends, that they don't understand. Um, they don't support them. They don't understand what's the problem with migraine. They feel isolated. A lot of people that are on disability because of migraine, they don't have much of a social connection. So that increases their inner stress. A lot of shame that I've seen with a lot of people I work with that live with migraine, that we blame ourselves. Why can I do those things? Why do I have those migraines that prevents me from doing all these things? A lot of people are struggling with self-esteem. They feel that they're, like less than other people. That also gets us to feel all sorts of things towards ourselves, being very angry, being depressed, being anxious, having these negative emotions towards all sorts of people, including ourselves, and engaging in negative self-talk, like this will never go away, my life is hopeless, I don't know what to do, there's no help for me, and so forth and so on. These are all things that are considered stressors, and by nature, they have the ability to further exacerbate migraine. So, with that said, hypnotherapy or the state of hypnosis can be a tool or a process that we can learn to adopt a specific mind state. And that mind state can help us do all sorts of things, can help us reduce pain, can help us build all sorts of inner resources like being more resilient, happier, more confident, so forth and so on. Maybe change maladaptive thoughts, like all those thoughts that go through our head, like life is hopeless, it will never get better, I'll never be better. So we can use hypnosis to change those. It can also be very much a relaxation practice, like for stress reduction. We can use that for emotional processing. So there's a lot of things that we can use hypnosis for. Of course, we won't be able to cover everything today, but hypnotherapy has a lot of have ability to work on many aspects that can help people living with migraine. And I'm not going to cover too much of this slide. I'm just going to put this slide up by saying that, first of all, hypnosis for pain has been used for many years. It's called hypnoanalgesia. And specifically for migraine, there's many studies that have been shown that hypnosis or the use of hypnosis can help with migraine disorders. And I'm not going to go through all of those uh, studies, but there are plenty. This is just a handful. There are more resources in the literature indicating that hypnotherapy can be useful for people living with migraine. So hopefully, if I convinced all of you that there is a room to use hypnotherapy with migraine, what I wanted to do today is to talk a little bit and to train, to kind of give you a little bit of the skill of self hypnosis. But before we do that, it is important for me to explain that there's a lot of wonderful books and a lot of wonderful audios out there that they say that it's under the umbrella of hypnosis, hypnosis for pain, hypnosis for all sorts of things, and they're wonderful. However, in my opinion, it is very important that before we use those audios or books or so forth, we need to understand that when we listen to an audio, it's not a passive process. In my opinion, everybody who wants to engage and learn self-hypnosis need to understand that this is an active process. The person wants to be hypnotized need to adopt specific skills that would allow them to get into the hypnotic state and experience hypnosis. And again, it's wonderful to listen to audios and go through these relaxations, but in my opinion, the more we understand what the process of hypnosis is, what is it actively that I need to do inside me to enjoy hypnosis, the better we are at actually benefiting from all these audios or from learning how to do self-hypnosis. So again, when we want to practice self-hypnosis, it should be goal directed. It's not that we're passive observers. We need to adopt specific mind states that would enable us to enjoy hypnosis. And some of the mind states are, first, imagination. The more we can engage our imagination, the more we can focus on the suggestions we give ourselves, the better we act into actually creating a response. Remember, hypnosis is when we're focused on an idea or an image or thought, and we want to elicit a response. So the more we can engage our imagination, for example, if I want to imagine that my shoulders are relaxing, the more I can really, really imagine my shoulders and imagine them relaxing, the better I am at actually eliciting a response. Number two, focus on absorption. Again, if I'm going to be distracted, then I'm pretty much not going to be enjoying what is it that the suggestions are trying to create in me. And I'm probably not going to see much difference. So the more we focused only on the specific suggestion, the better we are at creating and making the change and creating the response. Expectation. We are entering the state of hypnosis expecting that it would work, expecting that I'm going to see a change. The more I expect to see a positive change, the better I'm at in experiencing the change. If I'm just going to go to this saying, it's not going to work, I think it's BS, then obviously I'm probably not going to be able to elicit those resources enabling me to experience the change. Role enactment is something very, very important. And I want to give an example that I forgot the name of this actor, but there was a specific actor that he played a role of a taxi driver. And before the movie, he constantly he was around taxi drivers. And the movie, he played a taxi driver. And was interesting that after the movie ended, it took him a while to stop being a taxi. It's like being a taxi driver. It's like in his mind, he was still a taxi driver. So role enactment, meaning that ourselves, inside ourselves, we need to really adopt the role of being the hypnotized person. What does that mean? And at first, it's like we need to play as if we're really being hypnotized. The more we can adopt the role, the better we are at experiencing hypnosis. Belief. The more we believe that our suggestions are actually producing a response, the better we are at experiencing hypnosis. And motivation. One time trying self-hypnosis is probably not going to work. This is a skill. Just like every other skill, the more we use it, the more we practice in it, the better we are at actually being successful in experiencing hypnosis. So being motivated into practicing and rehearsing those mind states and trying more and more will make us more successful at experiencing self-hypnosis. So with that in mind, I would like all of us to really look at all of those mind states that are important to getting to the hypnotic state, using imagination, being focused on the suggestions, expect to see a change, really being the hypnotized person, believe that you can do it, believe that you can be hypnotized, and be motivated to keep practicing. Those are important mind states to the successful use of hypnosis. So without further ado, I also want to say one last thing, that all hypnosis is self-hypnosis, meaning that every hypnosis, even if you're guided by someone else who is a hypnotist, it's all eventually your job into being and getting into the hypnotic state. The hypnotist can maybe give suggestions, but it's only you that are able to adopt the suggestions, use the mind state that we talked about to really experience the state of self-hypnosis. So every hypnotherapist knows that all hypnosis is self-hypnosis. The more you allow the process to be, the better you are at experiencing and benefiting from hypnosis. So now I would like us to practice a little bit by the time that is left, uh, to practice self-hypnosis. And the way that we're going to do that, I'm going to guide you through. And again, I'm just the guide, but the person who's doing the process is all of you. We're going to start with an induction. Induction is a cue that we give ourselves that we're starting the process, of hypnosis, and kind of here we go. It's a cue to get into that state. The induction, we're going to plenty of types of inductions. We're going to use something simple called eye fixation. After we're doing the induction and we're starting getting into the state of hypnosis, we need to reaffirm that we're getting into the self-hypnosis state. We're kind of like giving ourselves a pat on the back. Good, you're doing very well. Then we're going to engage in progressive relaxation. During progressive relaxation, I'm just going to give the suggestions, but all of you would need to repeat in your mind's eye a phrase that is going to elicit a state of relaxation. I'm going to suggest, just for the purpose of this exercise, when we're going to go through each and every body part, to name the body part and say, for example, my head is getting deeply relaxed. And you can modify it in any way you'd like that might, that you might connect with more. I'm just going to suggest maybe use those phrases, my head is getting deeply relaxed, my eyes are getting deeply relaxed, and so forth and so on. Make sure that when we go through the areas, make sure you have a mental connection. Remember, imagination. Remember to visualize or imagine each and every area, rehearse the suggestions that induce relaxation, and maybe you can give it a color. Maybe think of a color that is relaxing to you. I don't know, it could be maybe like a blue or whatever is relaxing to you. And maybe imagine that this color is kind of like going through each and every area, making those areas more relaxed. Remember, the more you use imagination, which is one of the mind state, the better you are at eliciting a response. After we're going to be done with the progressive relaxation, I'm going to deepen. So that's kind of like a mental deepening. So we're going to calm the mind after the body's calm, and I'm going to count from 10 to 0. And then I'm just going to provide you with just one suggestion that was coined by Emil Coué, who is pretty much, a lot of people consider him to be the father of self-hypnosis. The statement, the suggestions that he used, which I very much enjoy, is day by day, in every way, I'm getting better and better. That's just a general suggestion to kind of increase wellness. And I would like us to use that suggestion today in our practice. And of course, once you are practicing on your own, you feel free to use that suggestion as well. After we're done, the hypnosis is going to end. And so I'm going to do re-alerting. I'm going to count from 1 to 5 and slowly have all of you come back to the room, to the here and now, but taking with you the benefits of hypnosis. So again, we're going to start with induction, reaffirm, relaxation, deepening. We're going to do one suggestion and re-alerting. So with that in mind, I'm just going to stop sharing and going to ask all of you who are with us, either uh, present today in the meeting or listening in the video. I would like all of you to just take, choose a comfortable place that you won't be disturbed. Notice if you have any phones or anything, maybe turn them off. Make sure that you don't have any pets or people around that might disturb you, because a lot of times to really enjoy the state of hypnosis, it's best to really take some time to yourself and make sure you're not disturbed by anybody, noises, or anything. And once you're ready, just allow yourself to just sit comfortably. Don't close your eyes just yet. We're going to start with induction. What I would like you to do, I would like you to make sure that your face is just looking forward. And without moving your head, without tilting your head, I would like you to just with your eyes go and find a place just directly above you on the ceiling. Find one spot and just focus on that one spot without moving your head. Now make sure that's not too uncomfortable, but just mildly uncomfortable. As you're doing that, notice how much your eyelids are becoming heavier. And go ahead, start saying to yourself, my eyelids are becoming really heavy. My eyelids are really, really heavy. My eyelids become really heavy. Imagine how heavy your eyelids become. And just imagine, notice how much how much you're squinting, and notice that your eyes are maybe fluttering, your eyelids are fluttering, and you might be getting kind of watery eyes, and that's good. And whenever you're doing that, just keep reminding yourself, keep telling yourself, my eyelids are becoming really, really heavy, really, really heavy. And whenever you feel that your eyelids are ready to close, that it will really, they just want to close by themselves, go ahead and close your eyes. Just allow them to close. And as you're doing that, go ahead and tell yourself how well you've done, and tell yourself, I'm getting into self-hypnosis. My body is responding to my suggestions. My body is responding to my suggestions. I can easily get into self-hypnosis. All suggestions are being accepted by my body, and really reaffirm to yourself how well you've done and how much your body has accepted your suggestions. And as you're doing that, allowing yourself now to go even deeper, we're going to start from head to toe. And with each and every area, I would like you to repeat in your mind's eye twice the name of the area, and saying, getting deeply relaxed, starting with the head. My head is getting deeply relaxed. Go ahead and repeat that couple of times to yourself. Imagine the muscles relaxing. Imagine maybe a color that is soothing, comforting, and really imagine that this color is like encompassing your entire head. Keep rehearsing to yourself, my head is becoming really, really relaxed. My head is getting really relaxed. And go ahead, move from your head to your forehead and keep rehearsing. My forehead is getting really deeply relaxed. Deeply relaxed. And you can rehearse that many, many times, as much as you want. Go down from your forehead to your eyes. My eyelids are deeply relaxed. Eyelids are deeply relaxed. And maybe you'd like to imagine that your eyelids are really, really, really heavy. So heavy it will take much more energy to open them than it will even be worth. Really imagine how deeply heavy your eyelids are. Go ahead, keep giving yourself suggestions. My cheeks are becoming really, really relaxed. cheeks are becoming really relaxed. Imagine, remember focusing, imagining, rehearsing. Make sure you keep rehearsing suggestions in your mind's eye. Down through your mouth, is deeply relaxed. Mouth is becoming deeply relaxed. Your jaw, my jaw is becoming deeply relaxed. Repeat it as many times as you want. And down to your neck and throat. Repeat those suggestions to you. Imagine neck, your throat, how much relaxed they become. Down to your shoulders. My shoulders are getting deeply relaxed. My shoulders are deeply relaxed. Down through your arms, elbow, forearm. Just repeat, keep repeating, keep imagining, keep connecting with those areas. Imagining and just feeling how deeply relaxed they are. And down through your fingers. Just imagine that both arms are deeply relaxed. I'd like you now to just notice and tell yourself, both my arms are heavy. Both my arms are really heavy. Keep giving yourself suggestions. How heavy your arms are. And really pretend and imagine what it would be like if your arms would have been like really huge steel rods, like so heavy, you can't move them. They're just heavy, as if they're glued to the chair or wherever they're sitting. They're just really, really heavy. And just pretend and imagine what it would be like if your hands are really, really heavy, so heavy, you can't move them. And allow this relaxation to flow down through chest, repeating the suggestions. Chest is becoming really relaxed, going down through your belly, low back, imagining the color, deep relaxation, imagining the belly and lower back, deeply relaxed. Imagine the relaxation flowing down to your hips, repeating suggestions. Hips are deeply relaxed, deeply relaxed, allowing the relaxation to flow down. Really focus on your suggestions, and it's okay if your mind drifts and wanders. That's what minds sometimes do. Whenever you find that your mind drifts and wander, just allow yourself gently to bring your mind back to the here and now. Keep focusing on the suggestions, imagining each and every area getting deeply relaxed, noticing how muscles becoming heavier, maybe warmer, comfortable, down to your thighs, becoming deeply relaxed, and down knees and your shins, deeply relaxed, and your feet, toes. Go ahead, imagine that your body is deeply relaxed. Go ahead, keep suggesting, affirming to yourself, my body is deeply relaxed. And notice how every nerve and muscle, how much your body is responding responded to your suggestion, to your desire to get deeply relaxed, to become more and more relaxed. The more you practice self hypnosis, the more the body can respond to your desire, to your suggestion to be deeply relaxed. And you can maybe scan your body right now. After you scan your body, you might want to focus and notice if there's anywhere in your body that might have residual tension. And if there is, you can just imagine that area and just visualize as if this area, every tension in there just kind of becomes like a mist, like a smoke, and just is getting out of your body. Just kind of poof. This is disappearing like a mist, allowing the body to relax even more. And now that the body's relaxed, the mind can follow. I'm going to start counting from 10 to 1. When I'm going to get to 1, you'll be in your ideal state of relaxation. Maybe it's a state you've been in before, or maybe you can surprise yourself. And when I'm going to get to 1, you'll be in the most relaxed state you've ever been. And I don't know if you know, I definitely don't know. Maybe you can surprise yourself. I'm going to get to 1 to see how much more relaxed you can become. And with each and every number, I would like you to repeat the number after me. And after each and every number, repeat the words deeply relaxed. And then notice how each and every time you're going to repeat the numbers, your mind is going to respond to your suggestions and you become really, really deeply relaxed. Starting from 10, deeply relaxed. Going to 9, deeply relaxed. And 8, deeply relaxed. Notice how each and every number, you get even more relaxed than before. And 7, deeply relaxed. Allow your mind to really just calm down. Complete calmness, serenity, complete relaxation. 7, deeply relaxed. And 6, deeply relaxed. Going to 5, you're almost there. Deeply relaxed. And 4, deeply relaxed. 3, deeply relaxed. 2, deeply relaxed. And 1, deeply relaxed. And notice how much relaxed you feel. How much you're enjoying right now this state of relaxation. Notice how you're in your ideal state of relaxation, which allows you to focus on suggestions and allowing suggestions to just become and influence you and allow you to be better and achieve whatever is it that you want to achieve. And with that relaxed state, I'm going to ask you to repeat the suggestions that we discussed beforehand. Every day, in every way, you're getting better and better. Every day, in every way, better and better. And go ahead and keep rehearsing that, just like a mantra. Rehearsing that mantra every day, in every way, getting better and better, and believe in the suggestions. Imagine what it would be like to get better and better each and every day. Imagine how wonderful that feels. Really be absorbed in that idea of how much you're getting better and better each and every day. And the more you're using those suggestions, the better you become. And keep rehearsing those. Really absorbing that suggestions each and every day in every way. I'm getting better and better every day, every way. I'm getting better and better. Really focus on that mantra, and you can keep saying to yourself that mantra as much as you want. Each and every time that you're saying the mantra, you're being absorbed in it more, allowing that to become your ultimate truth, allowing that mantra to really be true for you, and allowing yourself to really imagine how it would be like when you're getting better and better each and every day. I'm going to stop talking for about a minute. Have you really keep rehearsing that mantra, and after a minute, I'm going to start re-alerting. So take your time and rehearse the mantra in your own mind. And knowing that you can continue enjoying that suggestion, even once you get out of hypnosis, the suggestion can keep going, keep helping you, keep improving you each and every day, knowing full well that you can always come back to that state, feeling wonderful, repeating that suggestion, allowing that wonderful, relaxing state of mind to take it with you after you're done with self hypnosis, and keep enjoying the benefits of practice that we've done today. And with that in mind, we're going to start re alerting. I'm going to start counting from 1 to 5. When I'm going to get to 5, you open your eyes, be in the here and now, relax normal in every possible way, enjoying the benefits of the exercise that we've done today. Start from 1, slowly. Notice your body, notice yourself. Going to 2, allow yourself to become more and more aware, more awake, aware of your body, more aware of your surroundings. So you're slowly coming back to the here and now. 3, go ahead, allow yourself to maybe wiggle your fingers, your toes, more aware, more awake. And 4, you might want to stretch in the chair and move a little bit, stretch your head, stretch your legs and your arms. And 5, go ahead and open your eyes, feel relaxed, normal in every possible way, and taking the benefits from the self-hypnosis practice. Okay, well, that was just a very small section of teaching a little bit about hypnosis, self hypnosis, how to utilize that, how to do that on our own. You can use that skill only when it's safe to do so in your own life. And before I'm going to ask the participants to share their thoughts, since this is the end of our headache school, I hope the people who are watching us have enjoyed that session and found it beneficial, and we look forward to seeing you next time. So just before we talk to the people in the room, Nelly, I'm going to ask you to turn off the video.